HIV stands for human immunodeficiency virus. It's a virus that attacks the body's immune system. The immune system is our body's defense against illness. It's like an army that fights off germs and keeps us healthy. HIV weakens the immune system over time. This makes it harder for the body to fight off infections and diseases. Imagine your immune system as an army. HIV is like a spy that weakens the army from the inside. When HIV weakens the immune system, even mild illnesses can become serious. This is why people with HIV are more likely to get sick from things that wouldn't normally harm a healthy person. Understanding how HIV works is the first step in protecting ourselves and others. It's time to face this modern plague head-on with knowledge and compassion. Many people use the terms HIV and AIDS interchangeably, but they are not the same thing. Understanding the difference is crucial for proper awareness and treatment. HIV is the virus that causes AIDS, which stands for Acquired Immunodeficiency Syndrome. HIV attacks the body's immune system, specifically the CD4 cells, often called T cells. Think of it like this: HIV is the seed, and AIDS is the tree that grows from it. Just as a seed needs time to grow into a tree, HIV takes time to progress to AIDS. When someone is infected with HIV, the virus begins to damage their immune system. This damage makes it harder for the body to fight off infections and diseases. This process can take years. In some cases, it can take more than a decade for HIV to progress to AIDS. During this time, the person may experience some symptoms or no symptoms at all. Symptoms can be mild and easily mistaken for other illnesses. AIDS is the most advanced stage of HIV infection. It is diagnosed when the number of CD4 cells falls below a certain level, or when certain opportunistic infections occur. It occurs when the immune system is severely damaged and can no longer fight off certain infections. These infections can be life-threatening. These infections are called opportunistic infections because they take advantage of the weakened immune system. They are a major cause of illness and death in people with AIDS. It's important to remember that with proper treatment, HIV can be managed, and the progression to AIDS can be prevented or significantly delayed. Antiretroviral therapy, ART, is the key to managing HIV. Early detection and treatment are crucial for living a long and healthy life with HIV. Regular checkups and adherence to medication can help maintain a strong immune system. In the early stages of HIV infection, many people experience flu-like symptoms that can be easily overlooked. These symptoms can include fever, headache, sore throat, swollen lymph nodes, and muscle aches, which are common to many other illnesses. These symptoms are often mild, and can be mistaken for other common illnesses like the common cold or flu, making it difficult to identify HIV early on. However, it's important to note that not everyone experiences these symptoms, and some may not show any signs at all. Some people may have no symptoms at all for many years after becoming infected with HIV, which is why regular testing is so important. This is why it's crucial to get tested if you think you may have been exposed to the virus, even if you feel perfectly healthy. As HIV progresses, it can cause a wide range of symptoms depending on which parts of the body are affected, and these can vary greatly from person to person. These symptoms can include weight loss, skin rashes, persistent diarrhea, night sweats, and fungal infections, which can significantly impact quality of life. If you experience any of these symptoms, it's important to see a doctor to get tested for HIV and receive appropriate care. Remember, early detection is key to managing the virus and living a long and healthy life. Regular checkups and open communication with your healthcare provider can make a significant difference. HIV is transmitted through certain bodily fluids, including blood, semen, vaginal fluids, and breast milk. The most common ways HIV is spread are through unprotected sex with an infected person and sharing needles or syringes with an infected person. It's important to dispel some common myths about HIV transmission. HIV cannot be spread through casual contact, such as hugging, kissing, sharing utensils, or using the same toilet. It's also not spread through mosquitoes or other insects. HIV transmission can only occur when infected fluids enter the bloodstream of another person. This is why it's crucial to practice safe sex by using condoms and to never share needles. Understanding the facts about HIV transmission is essential for protecting ourselves and others. Let's break down the stigma surrounding HIV by arming ourselves with knowledge and compassion. Early detection is key. Knowing your status can make a significant difference in your health outcomes. Getting tested for HIV is the only way to know for sure if you have the virus. It's a crucial step in managing your health. The test is simple, confidential, and often free. Many people are surprised at how quick and easy it is. Many clinics and community health centers offer HIV testing. These facilities are equipped to provide you with the care and support you need. Early detection of HIV is crucial for several reasons. It can significantly impact your treatment options and overall health. First, it allows people to start treatment early, which can help them live longer and healthier lives. Early treatment can also reduce the risk of transmitting the virus to others. Second, it allows people to take steps to protect their partners from becoming infected. This is vital for maintaining healthy relationships. There are different types of HIV tests available. Each test has its own benefits and timeframes for detection. Some tests can detect HIV antibodies within a few weeks of infection, providing early detection and peace of mind, while others may take a few months. It's important to understand the window period for each test. Your doctor can help you determine which test is right for you. They can provide guidance based on your specific situation. Knowing your HIV status is an important part of taking care of your health. It empowers you to make informed decisions. If you are sexually active, talk to your doctor about getting tested for HIV. Regular testing is a key component of a healthy lifestyle. HIV treatment, living long and healthy lives. Thanks to advances in medicine, HIV is no longer a death sentence. With proper treatment, people with HIV can live long and healthy lives. HIV treatment involves taking a combination of medications called antiretroviral therapy, or ART. ART works by stopping the HIV virus from replicating in the body. This helps to protect the immune system and prevent the progression to AIDS. When taken consistently and as prescribed, RT can reduce the amount of HIV in the blood to undetectable levels. Having an undetectable viral load means that the virus is effectively suppressed and cannot be transmitted to others through sexual contact. This is a major breakthrough in HIV treatment and prevention. Starting HIV treatment as soon as possible after diagnosis is crucial for achieving the best outcomes. Talk to your doctor about your treatment options and get connected to care. Life with HIV: managing the virus, managing your life. Living with HIV is a lifelong journey that requires ongoing care and management. However, with the right support and resources, people with HIV can live full and rewarding lives. One of the most important aspects of living with HIV is adhering to your medication regimen. Taking your HIV medications as prescribed is essential for keeping the virus suppressed and preventing complications. It's also important to prioritize your overall health and well-being. This includes eating a healthy diet, getting regular exercise, managing stress, and getting enough sleep. Connecting with others who are living with HIV can provide invaluable support and encouragement. Support groups and online communities can offer a safe space to share experiences, ask questions, and find resources. Preventing HIV infection is crucial for stopping the spread of this virus. There are several effective ways to protect yourself and others from HIV. Using condoms consistently and correctly during sexual activity is one of the most effective ways to prevent HIV transmission. Condoms act as a barrier, preventing the exchange of bodily fluids. Another important prevention method is pre-exposure prophylaxis, or PrEP. PrEP is a daily medication that can reduce the risk of HIV infection in people who are at high risk. Getting tested regularly for HIV and other sexually transmitted infections is essential for early detection and treatment. Knowing your status allows you to make informed decisions about your health and the health of your partners. Regular HIV testing is one of the most powerful tools we have in the fight against HIV. It's a simple, painless procedure that can provide life-changing information. Many people believe they don't need to get tested because they don't think they are at risk. However, HIV can affect anyone, regardless of age, race, gender, or sexual orientation. The Centers for Disease Control and Prevention recommends that everyone between the ages of 13 and 64 get tested for HIV at least once in their lifetime. People who are at higher risk for HIV, such as those who have multiple sexual partners or inject drugs, should get tested more frequently. Stigma is a major barrier to HIV prevention, testing, and treatment. It's often rooted in fear, misinformation, and discrimination. People living with HIV may face stigma and discrimination from family, friends, healthcare providers, and society as a whole. This can lead to feelings of shame, isolation, and reluctance to seek help. It's crucial to remember that HIV is a medical condition, not a moral failing. People living with HIV deserve our compassion, understanding, and support. By educating ourselves about HIV, challenging myths and stereotypes, and treating everyone with respect, we can help to break down the stigma surrounding HIV. HIV is a complex virus that can have a profound impact on people's lives. However, with knowledge, awareness, and proactive healthcare, we can overcome the challenges posed by this modern plague. Remember, getting tested for HIV is the first step to knowing your status and taking control of your health. If you test positive, there are effective treatments available that can help you live a long and healthy life. By embracing prevention strategies, supporting those living with HIV, and advocating for increased research and funding, we can work together to create a future free from HIV. Your health matters, and your future is worth protecting. Take control today.